Hello everyone, my name is Alison Kitson and I am the Vice President and Executive Dean of the College of Nursing and Health Science, Flinders University. And I have with me today Emer Muir-Cochrane, who is Professor of Mental Health Nursing at the college, and also Elizabeth DeBars, who's the Chief Executive Officer of the South Australian branch of the Australian Nursing and Midwifery Federation. Well, good morning, Emer and Elizabeth. It's really great that you're both here and we're talking about a really, really important thing, mental health, and how we as nurses can really do something about it. Emer, you are a mental health nurse, so tell us a bit about your journey.
I think I became a mental health nurse because of a natural curiosity to work with people and then to help people and be able and confident and have the skills and training to work with people when they're emotionally distressed and vulnerable, and to help them and their families on their journey to recovery.
And what are the things that you feel are the most important contributions that nurses can make to the whole team?
I think it's their assessment skills, their engagement with patients, consumers, their ability to relate and empathise with families and to provide comprehensive care using a range of psychosocial interventions, psychological therapies, and working with medication.
Okay, and Elizabeth, as Chief Exec of ANMF, you're really, really committed to making sure that there's the right numbers and the right skills. Tell us a bit about how you do that.
We think that mental health nurses are absolutely crucial to our health system, and in particular supporting mental health patients and their lives and the communities that they live in. We were able to support industrially the retention of a recognition of mental health nurses by embedding in the public sector enterprise bargaining agreement a provision which means that it is absolutely essential for a person to be working in a mental health unit or institution to make sure that they actually do hold mental health nursing credentials, or at minimum are working towards achieving them.
But you know, mental health is everywhere. So if you go into a cardiac ward or an acute ward, Emer, you know, the anxiety, the possible depression, how do we make sure that, you know, we get rid of the stigma around mental health and we actually start to make sure that everybody's working together?
Well, certainly the offerings of educational packages for registered nurses to explore and relate directly to their own patients, say for cardiac patients, post-cardiac events with depression, preoperative anxiety, and also reflecting on their own mental health. As you say, mental health and mental illness is everywhere. 1 in 5 people will encounter mental health problems, so it is in everybody's lives. And I think it's working towards that awareness and self-reflection and building opportunities for nurses to gain experience in mental health nurses, whether they only do small offerings of educational modules or go on to be a qualified mental health nurse with a postgraduate qualification.
So we're here today to celebrate something really brilliant, which is a partnership between the College of Nursing and Health Science and ANMF on launching this wonderful initiative. Elizabeth, what is it?
Well, we're absolutely thrilled. We think it's an exciting new initiative and a partnership. The principal issue here is making sure that nurses can undertake continuing professional development in bite-sized chunks that suit their lifestyle and their needs, but also are going to be delivering on the real-world problems and meet the gap that presently exists in the system, which is how does a person gain additional skills and expertise in a particular area, such as mental health nursing. But sometimes it's not suitable for a person just to start off undertaking a master's qualification, for instance. You know, people do have lives, families, jobs to fulfill, and so it's about enabling people to undertake those bite-sized chunks of learning but make sure that it completely articulates. And so you can start off with a short continuing professional development learning package, but that can also be recognised in support of a graduate certificate or maybe a graduate diploma, and then perhaps even a master's. So it's the person can see where their learning may take them, but they don't have to start at the end. They can start very much at the start with something that is manageable, but also is meaningful for them in their present working life.
You're a very experienced academic and educator, and I've been working 15 years in the same unit. I hear that there's this opportunity to do continuing professional development. The idea of university really scares me. I don't think I'm an academic. So how are you going to convince me that this sort of stuff is for me and it will make me be a better nurse?
Well, I think, as Elizabeth talked about, it's the bite-sized piece. Go in and have a taster. And the kind of courses that we're looking at are going to combine some of the acute care registered nurse skills, such as medication management, or potentially when people have had an overdose or when they have a psychotic episode, and match that with their own experience. And they can go in and, by the virtue of our profession, we have to undertake CPD activities anyway. Yeah. So they can go in and have a look for an hour or 2 hours and fulfil that requirement, and then hopefully we will engage them that way.
So it's a bit like a learning passport, and you have to do it to keep your registration every year. And you also get money for it because as part of the EB, that's a win-win situation.
Absolutely. There are provisions under the Enterprise Bargaining Agreement that recognise qualifications. So I think it's, again, it's perfect that a person could perhaps just have a taste in the first instance, but then build towards something that does attach a qualification to it, and again are able to manage that within their working life, and so be rewarded for it both professionally but hopefully also monetarily as well.
So October each year, Mental Health Week, really, really important time when we focus all of our attention and thoughts and energy into trying to make things better. If you had one thing, Elizabeth, that you could do, magic wand waving, what would it be in this space for the people of South Australia?
There are many, many opportunities for people to build their skills and to be able to provide appropriate and wonderful care for people in the future. But I think it's absolutely essential that nurses know that they themselves have an enormous role to play, and they, on an individual and collective level, can work together to make the system better. And part of that is by making sure that they are continually learning, improving their skills, and they're able to be there to step up when the more senior workforce does quite naturally retire. They'll be there to fill in those gaps, and we think that mental health nursing is the perfect way to start to fill those gaps because it is such a significant area of need and something that the community deserves to have a good and appropriate workforce to fill that need.
It's a win-win.
It's a win-win.
Emer, last word. If you had your magic wand, what would you do for the people of South Australia in nursing?
I think skill the registered nurse workforce in mental health. Learning's exciting. As you say, Flinders has got a great reputation in mental health and mental health nursing. We have blended, engaging, exciting, challenging materials, which I think registered nurses will enjoy and gain a huge amount from.
Excellent. Thank you both so much.